Hemolytic Uremic Syndrome, HUS, is a rare but serious condition characterized by the triad of microangiopathic hemolytic anemia, thrombocytopenia, and acute kidney injury. This syndrome is most commonly caused by infection with Shiga toxin-producing E. coli, particularly serotype 0157H7. HUS typically begins with the ingestion of contaminated food or water, leading to the release of Shiga toxin. This toxin damages the endothelial cells of small blood vessels, resulting in platelet activation, microthrombi formation, and red blood cell destruction. The kidneys are particularly affected due to their high vascularity. HUS often presents with bloody diarrhea, abdominal pain, and jaundice. Severe cases can progress rapidly to renal failure, neurological complications, and even death, especially in children. Management focuses on supportive care, including fluid and electrolyte management, dialysis for severe AKI, and blood transfusions. Antibiotics are not recommended for HUS as they may increase toxin release.